Tinnitus diagnosis. As soon as you notice the first symptoms of tinnitus, it is important to see an otolaryngologist specialized in this type of disorder so that the diagnosis can be confirmed and the most appropriate treatment determined. Your doctor will check your ears, head, and neck for possible causes of tinnitus. Tests that may be done are hearing, audiological test. As part of the test, you will sit in an acoustically insulated room and put on headphones through which certain sounds will be reproduced in one ear at a time. You will indicate when you can hear the sound, and the results are compared with those considered normal for your age. This can help rule out or detect possible causes of tinnitus. Movement. Your doctor will ask you to move your eyes, contract your jaw, or move your neck, arms, and legs. If the tinnitus changes or gets worse, this procedure will help detect an undiagnosed disorder that needs treatment. Imaging tests. Depending on the possible cause of tinnitus, you may need imaging tests, such as CT or MRI scans. The sound you hear can help the doctor detect a possible undiagnosed cause. Click. Muscle contractions in and around the ear can cause sharp clicks that sound like popping. They may last several seconds or a few minutes. Blood ringing or buzzing. You may notice fluctuations in sound, usually of vascular origin, when you exercise or change position, such as when you lie down or get up. Heartbeat. Blood vessel problems, such as high blood pressure, an aneurysm or tumor, and occlusion of the ear canal or eustachian tube, can amplify the heartbeat you hear. Pulsating tinnitus. Low-pitched bells. One of the disorders that can cause low-pitched ringing in one ear is Meniere's disease. Tinnitus can become very strong before an attack of vertigo, feeling that you or what surrounds you is spinning or moving. High-pitched bells. Exposure of the ear to a loud noise or explosion can cause a high-pitched sound or a buzzing sound that usually disappears after a few hours. However, if there is also a hearing loss, tinnitus may be permanent. Exposure to noise over a long period of time, age-related hearing loss, or medications can cause a continuous high-pitched ringing in both ears. Acoustic neuroma can cause a continuous high-pitched ringing in one ear. Other sounds. The stiffness of the chain of bones in the inner ear, otosclerosis, can cause low-pitched ringing in the ears, which may be continuous or intermittent. Earwax, foreign bodies, or the auditory cilia of the ear canal can rub the membrane of the eardrum, causing a series of sounds. In many cases, the cause of tinnitus is never determined. Your doctor can discuss with you the steps you can take to reduce the intensity of tinnitus or to help you cope better. Treatment. To treat tinnitus, the doctor will first try to detect any undiagnosed illnesses that can be treated and may be related to your symptoms. If the tinnitus is due to an illness, the doctor may be able to take measures that could reduce it. For example, removal of serum and removal of impacted earwax may decrease the symptoms of tinnitus. Treatment of a blood vessel disorder. Undiagnosed vascular disorders may require medication, surgery, or other treatment to address the problem. Drug changes. If a medication you take appears to be the cause of tinnitus, your doctor may recommend that you discontinue or reduce the use of that medication or change it to a different one. Noise inhibition. In some cases, the distribution of the noise may help inhibit the sound so that it is less annoying. Your doctor may recommend using an electronic device to suppress the noise. Some of the devices include the following: white noise machines. These devices that produce simulated environmental sounds, such as rain or sea waves, are often an effective treatment for tinnitus. You may want to try a white noise machine that has pillow speakers to help you sleep. Fans, humidifiers, dehumidifiers and air conditioning in the bedroom can also help cover up internal noise at night. Hearing aids. They can be especially helpful if you have hearing problems, as well as tinnitus. Assistive devices to simulate sounds. These assistive devices, which are placed in the ear and are similar to hearing aids, produce a low-volume sound that inhibits the symptoms of tinnitus. Tinnitus rehabilitation. A device placed in the ear emits individually programmed tonal music to cover the specific frequencies of the tinnitus you are suffering from. Over time, this technique can get you used to tinnitus and thus help you not to concentrate on it. Psychological support is usually a component of tinnitus rehabilitation. Medications cannot cure tinnitus, but in some cases, they can help reduce the intensity of symptoms or complications. Possible medications include the following: tricyclic antidepressants, such as amitriptyline and nortriptyline, have been used with some success. However, these medications are usually used only for acute tinnitus, as they can cause troublesome side effects, such as dry mouth, blurred vision, constipation, and heart problems. Alprazolam, Niravam, Xanax, may help reduce tinnitus symptoms, but some of the side effects are drowsiness and nausea. It can also cause dependence. Preparing for your visit, be prepared to talk to your doctor about the following: your signs and symptoms, your medical history, which includes any other health conditions you have, such as hearing loss, high blood pressure, or clogged arteries, atherosclerosis, the medicines you take, including herbal medicines, what to expect from the doctor. Your doctor will probably ask you a series of questions, such as the following: when did you begin to experience symptoms? What does the noise you hear sound like? Do you hear it in one ear or both? Is the sound you hear continuous or intermittent? How loud is the noise? How much does the noise bother you? Is there anything that seems to be improving the symptoms? Is there anything that seems to be making your symptoms worse? Have you been exposed to loud noises? Have you had an ear disease or head injury? After you are diagnosed with tinnitus, you may need to see a doctor who specializes in the throat, nose, and ear, otolaryngologist. You may also need to see a hearing expert, audiologist.